Hello everyone, welcome to the Doctor's Dictionary. We have with us today Dr. Pooja Arora. She is a doctor and consulting nutritionist. Dr. Pooja, a very warm welcome to our show. मेरा पहला सवाल अब आपसे ये रहेगा. Now these questions we have selected on जनता की demand. Whatever popular questions our audiences have, we make it a list and ask our doctors. Ma'am, what's PCOS?
PCOS is polycystic ovarian syndrome जो females में पाया जाता है. This is a hormonal disorder. Generally जो ovaries होती है females की, उसमें से every month one follicle mature होके जिसमें से ओवम रिलीज होता है. बट PCOS में मल्टीपल फॉलिकल्स फॉर्म होते हैं बट नन ऑफ द फॉलिकल रीचेस द मैच्योरिटी लेवल. दिस इज अ हार्मोनल डिसऑर्डर एंड ये कैसे पता लगता है? इसके कुछ सिम्टम्स होते हैं. द फर्स्ट सिम्टम इज दैट फीमेल डेवलप्स इरेग्युलर पीरियड साइकिल, पीरियड्स डिले हो जाना या जल्दी आ जाना. जनरली डिले होना. शी डजंट गेट पीरियड एवरी मंथ बट शी मे गेट हर पीरियड्स एवरी 2 to 3 months. दिस इज द फर्स्ट साइन ऑफ PCOS. इसके अलावा एक्ने, hirsutism means male type hair growth on the face of a female, on the chest, on the back, darkening of certain skin areas, male type baldness यानी hair जो है वो light हो जाना और baldness develop होना. ये सब सिम्टम्स डेवलप होते हैं तब PCOS हो सकता है एक फीमेल को. टाइम से चेकअप करा के और ये डायग्नोज करवा के इसको ठीक से ट्रीट करवाना ही चाहिए. अदरवाइज अ फीमेल में लेटर ऑन डेवलप इनफर्टिलिटी एंड ऑल्सो शी may develop endometrial cancers or heart diseases or obesity and she may also develop hypertension in her body on the later stages.
Ma'am, how does one's diet affect the PCOS condition?
Generally, processed foods are the basic reasons for PCOS. Processed foods like refined carbohydrates and packaged foods like breads hai, maida products hai, bakery items like biscuits, cakes, pastries, या packaged foods हैं या जो sugary drinks हैं like fruit juices, packaged fruit juices or other sugary drinks, cold drinks. These are the main sources where PCOD could be developed because refined carbohydrates excess amount में consume करने से insulin resistance भी develop होता है which is also associated with PCOS. So if a female is suffering from PCOS, she should be avoiding the refined carbohydrates, the sugary drinks, the desserts, the products made out of refined flour like maida. Rather, she should be consuming more of whole grains and wholesome foods. So, these are the foods that should be avoided when a patient is suffering from PCOS. And not only if a person is suffering from PCOS, as such, these foods may lead to many other disorders like diabetes, like blood pressure, heart diseases, obesity. So, as such, every person should be avoiding these diseases. So, a PCOD patient should not feel pity for herself that she is not allowed to eat such types of foods. Well, such foods can just be occasional because they are empty. They are the empty calories. They are not going to give you any nutrients. Rather, they are just going to deteriorate your health gradually. A PCOD patient should also be avoiding alcohol and smoking. Alcohol gets converted into sugar very rapidly in our bodies. Also, it disturbs the hormonal levels, which are already very disturbed in a PCOD patient. So, a patient should be avoiding alcohol and excessive smoking.
Ma'am, what are the foods that could be included or avoided from the diet of a person having PCOS?
Food that is wholesome, complex carbohydrate, good proteins, good fats should be consumed in their diet to avoid PCOS, to avoid the symptoms and to treat the disease itself. Very important factor when a person is suffering from PCOD is a person, if she is able to lose weight, she'll be able to reverse PCOD. So it's important that you keep your weight in check. And when you're not consuming the processed food, the junk food, and you're eating the wholesome food, there are fair chances you'll be able to manage your weight very well. So whole grains, legumes, pulses, these are the good sources of complex carbohydrates. Millets हैं, fruits हैं, vegetables हैं, ये सब ample amount में consume करना चाहिए. You should not be consuming refined carbohydrates, simple carbohydrates, but complex carbohydrates are important. They have many health benefits which should be consumed. Good proteins should be consumed. Good proteins like milk and milk products, milk, paneer, curd, cheese could be consumed. Legumes and lentils हैं जिसमें से good proteins मिलते हैं, that should be consumed on a regular basis. A female should make sure that every meal has a portion of protein in her diet, which will also help manage her weight, and it will also help manage the symptoms of PCOS. Good fats are also very important in a PCOD patient. We generally feel कि weight loss करना है because PCOD है तो fats नहीं consume करना है. But there are good fats and there are bad fats. We all know about it. And it's important to consume good fats. We get good fats from nuts and seeds like almonds, walnuts. There are a variety of seeds like pumpkin seeds, flax seeds, which give you good fats. So include these seeds and these nuts in your diet on a regular basis. It's very important that you consume a lot of fiber in your diet because not only it will make you full and will help you manage your weight, manage your PCOD symptoms, but it will also provide you with essential vitamins and minerals that will help you with your skin issues जो PCOD में हो जाते हैं, like acne है या जो baldness आ रहा होता है, उसमें ये vitamins and minerals बहुत help करते हैं. So make sure you're consuming a lot of fiber in your diet through a variety of vegetables and fruits. जो भी आपके major meals हैं like breakfast, lunch and dinner, उसमें half of your plate should be full of vegetables and salad. 1 portion of protein and 1 portion of complex carbohydrates. So this makes a wholesome meal which will help you with the symptoms and with managing your weight.
Ma'am, what lifestyle changes can one person bring to cure or avoid the condition of PCOS?
Well, when a person develops PCOD, a doctor does advise with certain lifestyle changes where डाइट का सबसे ज़्यादा इम्पोर्टेंस होता है और डाइट में क्या चेंजेस करने हैं वो ऑलरेडी वी डिस्कस्ड. इसके अलावा इट्स वेरी इंपॉर्टेंट दैट अ पर्सन स्टेज फिजिकली वेरी एक्टिव. नॉट ओनली इट विल हेल्प मैनेज वेट बट फिजिकली एक्टिव रहने से ओवरीज भी एक्टिव रहती हैं एंड एम्पल अमाउंट ऑफ हॉर्मोन्स रिलीज कर पाती हैं. सो PCOD के सिम्टम्स मैनेज होते हैं, PCOD रिवर्स होने में भी हेल्पफुल रहता है. इसके अलावा sleep is also very important. PCOD patients should be taking ample amount of sleep, 7 to 8 hours of sleep. And last but not the least, managing stress. Avoiding stress is very important to manage PCOD. If you feel that you're very much stressed, exercise should help you, good eating should help you, good sleep should help you. But if all these things are not helping, you should take the help of meditation too.
So ma'am, हमारे questions यहीं पे खत्म होते हैं. I would like to express my gratitude that you came to the show, spared your time and shared such wonderful plethora of information for our viewers. And I would like to ask your views कि आपको ये series कैसी लगी?
It was such a pleasure sharing the useful information with all you viewers. I hope I would have helped clear many of your doubts and I insist to watch the entire series. Thanks a lot for having me.
If you are a good listener and would like to have knowledge on the go while walking, eating, drinking, do subscribe to our podcast, our conversation on the Doctor's Dictionary, Google Podcast and Spotify.